Northampton Mayor David Narkewicz has issued several executive orders related to the new coronavirus well ahead of state or federal leaders, beginning with a citywide state of emergency in mid-March. Narkewicz is also the highest profile public figure in the region who announced publicly that he had COVID-19. Carrie Saldo spoke with Narkewicz yesterday about how he's feeling and governing during the coronavirus.
I feel great. I feel fine. I know I gave folks a little bit of a scare there back in March, but I'm fully recovered. I haven't had any COVID-19 symptoms, and feel fortunate that I was able to recover at home, and obviously didn't require hospitalization or so I feel fortunate, and my family is healthy as well.
There have been so many different reports about what symptoms people experience, how they experience them. Can you give us a sense of how you first noticed that you weren't feeling well, and then what the course of the disease was like for you?
Well, for me, it started on a Monday, and it was basically a sore throat. And then it turned into more flu-like with a cold and flu symptoms. And when I became concerned was when I started having a low-grade fever, and I had some chills at night, which were, some of the classic symptoms. And again, it may have just been flu. I'd had a flu shot. But once I started having a fever, it was at that point that I, contacted medical folks, and the decision was made to get me tested. And so I was tested, and then, I think by Thursday of that week is when I made the public announcement that I had tested positive. So I began sort of isolating myself or quarantining myself when I had the symptoms. And then I basically had to just isolate myself in a first floor guest bedroom of our house, and use a separate bathroom, and eat my meals, and sleep, and try to run the city from my older daughter's former bedroom. So that's sort of how it played out. Again, I then eventually reached a point after a couple of weeks where the symptoms had subsided. I was no longer, having the fever. And then once I was feeling symptom-free for 72 hours, I was allowed to then leave isolation. So, and again, that was back in early April. So I'm many, many, many weeks past my brush with COVID-19.
A lonely sounding couple of weeks for you there, isolated in that bedroom space, but also sounds like you were pretty much able to continue working while also struggling through this.
I was, and I've heard lots of different stories and talked to people who've had just different experiences with the virus. And fortunately, obviously, I needed to get rest and recover, and do the things you do when you're sick. But I was not incapacitated. I didn't have the breathing issues that some people have experienced. So yes, I was basically, holding daily staff emergency meeters via this medium, Zoom, which we've all come to learn, and obviously working on issues that were arising on a day-to-day basis related to the pandemic.
Certainly glad to hear that you're feeling better. Has the fact that you had COVID-19 and recovered changed the way you're thinking about governing in this really unprecedented time that we're living in?
I wouldn't say that it's changed the way I've governed. I mean, I feel like I'm really proud of the way all city employees have sort of adapted to this new environment. Many of them have become remote workers, literally had to become remote workers overnight as we closed a lot of our non-essential buildings. But we've been able to continue to keep services going and providing the basic functions that people need. Obviously, our first responders and public safety and public health folks are on the front lines, and I'm extremely proud of them. But in terms of my approach, I think it certainly has helped in terms of the message that I was trying to convey, and the modeling I was trying to do around safe social distancing and hand washing. I mean, I was giving out all that information, but I do think it hit home when suddenly I was positive. At that point, it was still fairly early, and there weren't many reported positive cases in Northampton or Hampshire County for that matter. And so the fact that somebody somewhat high profile as myself had it, I do think that drove home how serious this was, and that this was not just something that was affecting immunocompromised or elderly people, which is, I think, some people were a little bit lax early on because they assumed that it would not affect them, or if it did, they would be fine. And so anyway, I think that was probably my contribution to raising people's consciousness about the virus, the fact that I actually went through it, and people sort of got to follow that.
As you have approached this issue, you've been out front on a number of areas, either ahead of the state government or the federal government, in issuing some advisories, including one that came out in April, which mandated that people working in essential businesses and patronizing essential businesses be wearing face coverings. What guidance did you use to sort of make that determination?
We've worked really closely as a team, and I rely heavily on our public health experts, our health director, Meredith O'Leary, who's really a regional expert here in Hampshire County, and is on the forefront of leading so many other efforts outside of this pandemic, and obviously looking to CDC and looking to DPH, and really just trying to figure out what we can do to protect people. And obviously we know that these essential businesses are open, and people need to buy groceries and get prescriptions. But we really wanted to just put in place measures that would minimize the possible spread of the virus. So yes, we have put in place, we closed some parks, again, prior to that happening in other places. Obviously, the face covering, we were one of a handful that implemented the face covering. Actually, as we speak today, is the day that the governor's face covering order, which is very much like ours, is going into effect statewide in Massachusetts. So I feel like we've been a little bit on the forefront, but it's mostly been out of an abundance of caution and wanting to basically err on the side of caution. Obviously, this has created some inconvenience for people, but I'd rather be blamed for being too cautious than for being lax and having more people catch the virus.
The governor's order, as you referenced, is now in effect. Face coverings, if you can't social distance, or when you're in places of, those essential businesses that are still open, you need to be wearing them. Do you think that the governor waited too long in rolling out that order?
I don't want to second guess the governor. Obviously, he's getting a lot of inputs from a lot of different sources, and he's listening to his Secretary of Health and Human Services. I do think that were I in that position, I probably would have moved a little faster in terms of, especially even some of the. In terms of the advisories, the stay-at-home advisories. But I also understand that, I work with a small team here at the local level. He's obviously working with a larger team with a bigger statewide lens. So I don't want to second guess the governor. I think this is not a time. We need to be united, and we need to, use the best information we have. But again, I believe that local cities and towns, obviously we have to follow the governor's order, and we can't do anything less restrictive than the governor's order. But I do believe we have the authority to go further than the governor. And so for us, for here in Northampton, we have gone a little bit further, a little earlier.
You did see some protesters out over the weekend in Northampton protesting some of the orders that you've issued and that even the governor has issued regarding stay at home or which businesses are open. And some of those protesters raised concerns that their civil liberties are being violated by these orders. Do you think that that's the case?
Well, I at least was gratified that when the gentleman who had led the march was being interviewed, he was wearing a mask. So I thought he was wearing a face covering, and I know that there had been some attempts to social distance among the protesters. So I felt like that was at least a small concession that this is a serious matter. We're obviously in an unprecedented time, and we have this invisible killer really that just is unprecedented, probably not since the Spanish flu. And we are seeing rapid rises in infection. Obviously, the death count nationally and even here in the state, has been growing exponentially. And so clearly in a time like this, we need to take some serious measures to protect people. And again, we're doing it not to strip people of civil liberties. We're doing it to really for their own protection and for the protection of their neighbors and their loved ones, and especially for the protection of these essential workers who are working on the front lines of making sure that the food system continues to operate, and pharmacies and all these other businesses. So I feel like it's a balancing act, and obviously there are plenty of provisions for people who have health issues and other issues. But really, I feel like it's not meant to strip anyone of their civil liberties. It's really meant to try to protect their public health and the health of those around them.